We're among the wealthiest countries globally. Yet America leads with the most expensive yet ineffective healthcare when compared to the rest of the countries like it. And across San Diego County, around 1 in 4 adults and 1 in 5 children are uninsured. This totals to about 500,000 people. And the United States as a whole isn't much better, with at least 28.9 million people being uninsured in 2018. Hi, I'm Aries, and today we're going to be talking about the difficulty some people have accessing and maintaining healthcare, and how people are being affected by our current healthcare situation in this week's episode of Community Connections. This is a series where we learn about social justice issues facing our community, learn from experts, and see how we can combat these issues. We need to understand all the factors that make getting and maintaining healthcare difficult. This means understanding our healthcare system a little better, knowing what barriers there are to accessing healthcare, and how we can join in the fight to get better healthcare for everyone. Before we start learning about the issues in our healthcare system, it's important to gain greater knowledge of the system itself. We should get some background knowledge on the subject. Healthcare coverage in the United States is provided through a combination of private health insurance and public health coverage. For example, Medicare and Medicaid. 2/3 of Americans receive health insurance through private insurance, usually provided by their employer. While some may receive their insurance through public measures like Medicare and Medicaid, many states never expanded coverage to ensure that everyone can receive healthcare. The problem is that whenever we look at all the other developed nations, we're in the minority of those who don't have a universal healthcare system. What is universal healthcare? Universal healthcare or universal health coverage means that all people have access to health services they need when and where they need them without financial hardship. It includes the full range of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care. This is important because about 100 million people are pushed into extreme poverty every single year because of out-of-pocket medical expenses caused by our private healthcare system. We have the highest spending on medical costs in the whole world. And despite this spending, Americans still experience worse health outcomes than their international peers. Americans spend an average of $5,000 a year on out-of-pocket health costs alone. This includes insurance, prescriptions, and medical supplies. And almost 1/3 of working Americans have some kind of medical debt. And about 28% of those have debts that are over $10,000. Obviously, when we look at healthcare in the United States, there's a big glaring problem, especially when it comes to access.
My name is Gaby. My pronouns are she, her, hers, or they, them, theirs. I work in the healthcare field, and I am going to school to get my license in clinical social work. If social work has to exist, then there's an obvious problem that needs fixing. A lot of children and older folk don't get the same access that they need, and especially our BIPOC communities. BIPOC means Black, Indigenous, and people of color. So that just makes up our vulnerable communities here in the US.
There are also more complex barriers to getting health insurance based on race and ethnicity. Studies show that Latinx people face more barriers to getting insurance than any other ethnic group.
If they don't have the same access to jobs even that can provide health insurance, how else are they going to be able to get it? No wonder a lot of vulnerable communities now are skeptical of the vaccine, because there's this constant reoccurring history of things that are supposed to be benefiting the greater good of society going back and doing the complete opposite for them. There's just obstacles that are being put in their position so that they don't get what they need.
Black and Latinx people are also more likely to receive treatment in emergency rooms versus their primary care provider. And this can be to lack of insurance or difficulty getting an appointment with their primary care provider due to lack of appointments. It can just be too difficult for their immediate needs. And for some without insurance, going to the emergency room is the only for sure way you'll receive treatment from any kind of doctor. This is due to the laws in place that prevent emergency rooms from turning away anyone, regardless of their insurance status. But where does the cost of those appointments go when people can't pay for them? The cost of us letting people just be uninsured costs us about $10 billion every single year. And that's a number that we get put on our taxes. And this could be so easily prevented if we had a system that already guaranteed that everyone could receive healthcare services and be covered by insurance. A change like this would ultimately save us billions of dollars every single year.
Universal healthcare is a great solution.
A universal healthcare system like this would ultimately make the government the primary provider of our health insurance, allowing and mandating it to provide quality care to everyone, despite their financial status. Why should we ensure that everyone in our community has access to healthcare?
COVID has hit our most vulnerable communities and is affecting them the most. Our minority groups and the people who are most vulnerable to these oppressive systems are seen as burdens.
What can the Bible tell us about providing health services to everyone? It's undeniable that Jesus loved providing healthcare to people. Throughout the Bible, we can see just the importance that Jesus puts on healing the sick. In Matthew chapter 4, verse 23, Jesus goes through Galilee, healing every disease and sickness among the people. And that wasn't the only instance of him healing in the Bible either. Healing, health, and wellness can be argued to be one of Jesus's primary tools for connecting to his people. And he made sure to give that healing to everyone he came across, regardless of their status in society or if they were outcasted or not. And if God has called us to act in Jesus's image, why aren't we ensuring that we give the opportunity of healing to everyone? Why don't we allow everyone to have the same access to compassionate and quality care that we do? This means that we need to ensure that regardless of the state someone may be in, that they can have access to quality healthcare without falling into debt or going into poverty because of these costs. And the most important way to do so is to be politically active in the movement for universal healthcare and other great changes in the medical system. Sometimes advocating for the rights of other people, especially politically, can be really intimidating. That's why I'm thankful that there's websites like healthcare-now.com, which provides so much information and tools to people like us so we can become involved in the fight for greater healthcare coverage. They even answer some of the harder questions that people might have about a universal healthcare system. Some of these questions are, would single payer drive up my taxes? Would this put the government between me and my healthcare provider? The best part about this website is that they have tools, workshops, lessons, and so much more for you to learn to become a better advocate.
The best thing that we can do in order to get a step closer to universal healthcare is supporting our local community health centers, using our time and our privilege to spread awareness and to give support where it's needed.
Another great organization to support are the Family Health Centers of San Diego, who have been working for the last 50 years to support underserved and uninsured communities. They're among the top 10 largest community health centers and serve over 200,000 people every single year. And their website has tons of information too, especially about how to volunteer, how to donate money to better their services, or even book donations. We should ensure that everyone has access to healthcare because Jesus did that exact thing. Because he believed that we're all deserving of quality and compassionate healthcare regardless of who we may be or where we may come from. And giving people access to healthcare betters their quality of life and allows them to prosper in ways that they might not have before. And to be quite honest with you all, there's not really a reason why this can't be a reality here in the United States when every other developed nation does this exact thing, especially as one of the wealthiest nations in the world. Let's work to educate ourselves about this crisis.
Activism is a lifelong thing, and it's something that you have to do day in and day out, and it starts internally. So educate yourself, get to reading, Google things for yourself. Don't feel entitled to ask our BIPOC communities and our vulnerable communities for resources, because we're supposed to be the ones giving them that.
And let's fight to take care of our neighbors as we take care of ourselves. If you like this video, please leave a thumbs up. Subscribe to our channel and make sure to hit the notification bell so that way you'll know when the next video is up. Thank you so much for watching this episode of Community Connections. I'll see you next time.